So with this we are discussing about intrauterine devices. So these are generally your intrauterine devices, uh, different types there like copper bearing IUCDs or hormone releasing IUCDs. So if we'll discuss about copper bearing IUCDs, it consists of polyethylene or polypropylene, and it will be like a plastic shaped letter T, and it is consist of a pure electrolytic copper, uh, for example T Cu380A. So copper as a cytotoxic, and it will enhance the spermicidal effect and also spermatodepressive action, and it is popularly nowadays used because it will resist the displacement and rotation within the cavity. Like that, different hormone releasing IUCD is there. Is T-shaped device made of polyethylene frame that measure around 32 millimeter in both vertical and horizontal direction. So there is a silicon reservoir which containing dispersed levonorgestrel or progesterone, which will be on vertical stem, and it contains a sleeve of rate controlling membranes of ethylene vinyl copolymer. So it can be able to prevent pregnancy up to 5 years by steadily releasing small amount of progesterone directly to the uterus. So it works by thickening the cervical mucus so that the sperm are more difficult to means having a spermicidal effect. With this, nowadays also there is another IUCD, not unmedicated IUCD. It is also made up of plastic or stainless steel. With this, there are different advantages or disadvantages of IUD is there, like it is highly effective for preventive pregnancy, inexpensive, and it does not require patient's involvement. It is an emergency method of birth control. So like that, so many advantages are there and disadvantages also there. So now let us discuss about development of IUDs, when it is developed, how it is developed. So it is part development of IUD began in the year 1920, that is the first generation IUDs, and uh, it was failed as of disrepute and for difficulty in the insertion, but slowly so many devices developed which are able to uh, compatible with the body, and in this some modification have been developed in IUDs which are introduced in last 30 years, which are having a anti-fertility agent, and that are more tolerated and smaller devices, and these are generally T-shaped devices, and generally different agents like E-aminocaproic acid and tranexamic acid or different types of hormonal drugs are used which will minimize the bleeding and pain. So with this, in the development, first the copper bearing IUDs. Generally these devices uses copper wire wound to the stem, and device is made of T-shaped polyethylene plastics, and generally the mechanism action is uh, it will ability, it is having a spermicidal effect, and generally high concentration of copper is cytotoxic, and generally we are taking a cupric ion which is a competitive inhibitor of the progesterone, and a lesser effect estrogen. So this next one is hormone releasing IUDs. So different types of hormone releasing IUDs are available and which are having anti-fertility activities, like your progesterone releasing IUD. Shortly we are calling in different brands like Progesta short. It is also a T-shaped progesterone releasing IUD which is having a vertical limb embedded with the drug progesterone, and which is containing in a silicon capsule coated with a polymer for achieving the slow release. And The progesta shot is a novel progesterone releasing IUD. Then this device has a solid poly EVA. EVA means ethyl vinyl acetate, which are having a side arms and hollow core. And microcrystalline progesterone is suspended in the core in the silicon oil with barium sulfate, and the progesterone will be released by diffusion through this rate limiting membrane. It does not inhibit the ovulation but interferes with the implantation of endometrium. So these are one type of devices. Like this, another device there, that is this one we discussed, that is progesterone devices. Another one is there, levonorgestrel, that is also a having contraceptive hormone, and so these devices will carry this levonorgestrel, and it contains around 52 milligram around its stem, and it is composed of a polyethylene stem covered by matrix ciliastine. So the initial fast release will be 60% of the drug release rate, which reduces to 16 microgram. So at first the dose will be more, then slowly it will be controlled, which will be 16 microgram per day. So which will suppress the endometrium and ovulation. So generally this type of IUDs prevent fertilization due to its damaging and killing ability of sperm, and making the mucus thick and sticky. So these are all about IUDs, intrauterine devices. With this your syllabus is completed. If any doubt you can ask me during the class. Thank you.